Hello everyone, I am Dr. Pankaj Tiwary, a practicing dermatologist in city of Patna and also associated with Patna Medical College as assistant professor. I am talking on behalf of DermaVidya and access to dermatology world. Today I will be discussing on fungal infections and hygiene, a very common yet overlooked health concern and very troublesome for patients. Fungal infections such as athlete's foot, ringworm, yeast and candida infections, they can affect anyone and they thrive in warm and humid and moist conditions. That's why they used to affect mainly the folds of our body like axilla, like groin, and those portions which are having more sweat content like our feet. In this video, I will deal with the basics of fungal infection, uncovering their causes, identifying the symptoms, and understanding the environmental factor that foster their growth. Then we'll also discuss the keys to prevent these infections in a proper hygienic way, how to practice a proper hygienic practices, which we'll explore in depth in this video. And then we'll provide some practical tips on effective cleanliness both of your body as well as your clothings and as well as your other accessories, so that you can stop the chain of growth, chain of infection, chain of transmission from one individual to another individual. And additionally, we'll discuss the available treatment options, both the over-the-counter medications as well as when a person should seek a professional medical help through a dermatologist. Our aim is to empower you with the knowledge, so that not only you can get a proper treatment, but you can effectively prevent the infection, you can effectively prevent the recurrence of fungal infection, you can prevent the spread of fungal infection from yourself to your family members or your close contacts. So basic of fungal infections. In fungal infections are commonly called as tinea, and from head to toe they can affect your body. The scalp infection is called tinea capitis. On the face, it is called tinea faciei, then tinea cruris, corporis. So depending on your type of part of body involved, it is given a different name. Causes is dermatophytic infection. Dermatophytes are those kind of fungus who thrive on the dead decaying part in our skin, hair and nail. There are three different types of dermatophytes and they thrive differently on skin, hair and nails. The symptoms, the main symptom of fungal infection is itching or pruritus. Be it in any part of body, it will cause remarkable pruritus. And the second thing is rashes, red round patches over the body, over the trunk, over the groin area, axilla, armpits. That's why they are called ringworm, because of their shape, that ring shapes. Now coming to the habits, to whom this tinea will persist for longer duration, in those individuals who are indulged in activities which causes too much of sweating, the sweat is not dried up properly and the individual is not getting themselves cleaned with that sweat. You have to bath twice to get the sweating. The sweat contains those elements on which fungal thrives more rapidly. So that is why areas where sweat is accumulated, like inner groin, like armpits, this fungal infection is more what we call ringworms or tinea cruris. So if you are getting this kind of infection, you are feeling that you are suffering from ringworm or tinea, you have to seek medical advice. Because the over-the-counter medications are not going to help you, not going to cure you. They'll give you some fixed dose combinations of antifungal with a steroid. You'll apply it and get some relief, but they are not going to cure you of that. So you have to seek proper professional advice of a dermatologist. They will give you some medications, oral medicines as well as topical medicines. And the hygiene practice is very much important. To avoid the recurrence, to avoid the spread from one individual to another, first thing is hygiene of your body. You have to take proper bath, you have to let your body dry, you have to use your towel and you have to dry up your towel daily. You have to use loose fitted cloths, cotton cloths. If you are going outside, you can use some kind of powder which will help you decrease this sweat amount of sweat. And then the clothings, you have to wash your clothing separately. Individuals who are suffering from this tinea, they should wash all their clothings, including their towels, their bed linens, their pillow covers. All things should be washed separately. And sunlight is a very good antifungal agent. So you can let these cloths dry up in sun, and all the fungal elements, including the spores, will go out. So cleaning and drying up in sun is very important to stop this resurgence and the recurrence of this fungal growth. Similarly, with the foot care, you have to take special focus on foot hygiene. People have to clean their nails, because tinea can infect your nails also, which we call tinea ringworm. And similarly, people who used to wear shoes for a pretty long time, they should use cotton socks. They should change their socks daily, and whenever possible, they should let their shoes dried up in sun, so that the shoes gets kind of sterilized from inside, so that all those fungal elements which are present in the shoes, they also get damaged, they also get dried up from the body. Now, managing those risky environments, whenever you are going to some kind of gym, some pools, or any public places, public toilets, there you have to maintain proper hygiene, and you have to take proper care so that you do not get these infections, or if you are suffering from this infection, you do not let others develop this infection. So that you have to take proper care. You have to use your personal belongings, you have to use your personal clothing, personal towels properly. If you are suffering from tinea or fungal infection, do not enter inside the pools, because the water, the chlorinated water, will cause further damage, and your fungus will spread to others through this pool's water. So there are some natural remedies also, like potassium permanganate wash. This is very good. You can wash with making it very light pink, like your just color of your nail bed. You can dissolve this potassium permanganate in water, and you can wash the affected area. It is a very good antifungal agent. So taking into account all these features, you can take care of these fungal infections and the hygiene. So I hope I've been able to overview the fungal infection hygiene, and if you find this video any useful for you, you can check out on the website DermaVidya.com. And as a doctor, my advice for any skin and hair related issues, do not self-medicate. Please get in touch with an expert dermatologist before the lesion gets overactive or lesion gets spread to whole of your body or into your family. Thank you.
For more such videos, visit or log into DermaVidya.com.